helping make your life easier. Moms Every Day.
Hey everybody, it's Hattie Cheek with Moms Every Day. We have Dr. Adel Faltaous with us today from Cabell Huntington Hospital. And we're going to be talking about, on the surface, what seems to be like almost a cosmetic thing, but it can be more than that. So when it comes to body contouring and how we want our bodies to look, a lot of people look to different ways of doing that. Today we're focusing on the contouring aspect. What does that even mean?
Body contouring means it improves the general picture of the patient, and it involves several areas according to the patient desire. Usually patient abdomen is very important, breast, arms, trunk, gluteal area, thighs.
The
These
legs,
are the areas
the stomach,
usually.
legs,
Yes.
stomach, and the butt, right?
Exactly.
That's what everyone's looking to
And
improve, aren't we all?
Correct.
Okay, so when it comes to contouring, though, I mean, how do you do it? What does it even mean to do that?
Basically, when we say abdomen, people call it tummy tuck or abdominoplasty,
Right.
in which we excise part of the skin and the fat, tighten the muscle, and stretch the skin and put it together. If we talk about the breast, breast can be breast lift, that's called mastopexy, or a reduction. Arms is called brachioplasty. Brachial means arm, plasty means tightening the arms.
So it's just like, it's basically just tightening and lifting everything.
Yes, exactly.
Right? The contouring.
The contouring.
We talk about it a lot when it comes to makeup. So there's so many different kinds of contouring that we can be doing.
Right.
When it comes to getting these procedures done, are they typically done together?
Some procedures done together, yes, depends on the patient desire, how much time they can devote, how their health is. For example, we can do breast and the abdomen in one setting. We can do arms and the breast in one setting. We can do abdomen and thighs in one setting. In the same procedure, we can do 2 different areas or sometimes 3 areas.
Can it make you sore afterwards? Is that why someone might not want to do them together?
Yes, there is definitely some discomfort, and it depends on the recovery, how much they want to devote for recovery, and how much they feel comfortable under anesthesia.
Now, are these outpatient procedures or inpatient procedures?
It depends on the area.
Okay.
Like abdomen, it is inpatient. They have to stay 1 or 2 days.
Okay.
The same thing for thighs. Outpatient, like the breast and arms, this usually outpatient, they go home the same day.
Go home the same day, just within a few hours.
Yes.
Why do you like to keep them if they're doing the legs, the inner thigh, or the abdomen?
For 2 reasons. First, for their comfort, so they have pain medication. The second, just to watch the position after abdominoplasty. Sometimes we keep them this way, or the thighs also, they have different positions, and it may be difficult for them to be acquainted with this procedure at home.
And you did mention recovery. Though certain take a few days, others you can be out. But when it comes to sore and just feeling totally normal again, how long does that usually take?
I would say, again, depends on the area. The breast, for example, recovery can be a week or 2. Abdomen between 2 to 4 weeks. It depends on the patient occupation and so forth. Thighs more or less there, like maybe up to 3 weeks. Arms can be a week.
A week, okay. And I have to ask you, when is the best time to actually get this kind of thing done? I have a friend who, she had 4 boys, and then she got all this done, and she was pregnant again.
Yes.
So,
Right,
I mean, is this something that you want to do after you've had all your babies? What? Okay.
Yes, I will tell the patient, first of all, how many kids you have, how you plan to have it further. Make sure that she's the last kid, or if she has another one, will be like 5 years or something. The second factor also about the weight of the patient. If the patient is planning to lose some weight, I would tell her, okay, lose weight first, because you don't want to do surgery and things sag again.
Okay. So this is something that you want to make sure will not be impacted by some great life event.
Right.
Like bringing another life into the world. I imagine that you've seen that happen.
Exactly.
Not everyone tries to have that happen, but yeah.
It can affect the result. And of course, the other thing also, the patient is a smoker, she has to quit smoking.
Okay, so quit smoking.
Yes.
Make sure that you're done having your babies, or if you need to lose weight, do that ahead of time. When it comes to insurance, though, is this kind of thing covered? Most of
the procedures are not covered by insurance. The only thing maybe related to the breast, if somebody has like large breast for breast reduction, can be covered by insurance. Or there's a congenital asymmetry of the breast, like one cup is an A and the other is a C or a D or something, or some chest wall deformity.
Some strange occurrence. So just always reach out. You can find out. It's a possibility that it'll be covered. If you want any more information, head to our website, WSIZ.com. Click on the Moms Everyday tab, and you can rewatch this interview and learn more about contouring. Thanks for joining us today. Have a great day.